Hello, I am Dr. Debopam Chatterjee. I am consultant pulmonologist and sleep medicine specialist at Apollo Multispecialty Hospital, Kolkata. We have seen that there is a surge in cases of COVID all across country as well as across the globe. The JN.1 is a subvariant of BA.2.86 belonging from the Omicron lineage of SARS-CoV-2 virus. This virus was first found out in the month of September, and it has been seen that since the first few weeks of December, there is a surge in cases not only in our country but across the globe. And in our country, the most of the cases have been predominantly limited to the southern Indian states of Kerala, Tamil Nadu and Karnataka. The JN.1 variant has got certain special features, like it has got increased transmissibility, that there is increased chances of transmission from one person to another, and there are chances that in the rapid kit tests we might not be able to detect JN.1. So that is why if you are having symptoms and you see that your kit test has come negative, you should always go for a RT-PCR test. Because of the mutations in the spike protein, there are chances that it might not be detected in the rapid kit tests. But the point of concern should not be there with JN.1 variant, because the vaccinations which we have received as a part of our protocol fighting against COVID, they show good protection against the JN.1 variant. They are simply as simple as running nose, fever, dry cough, shortness of breath, which can range from mild to severe, as we have seen in the normal COVID pandemic. And there can be certain gastrointestinal symptoms like diarrhea or nausea, vomit. Like the COVID pandemic, the mainstay of our protection is masking, maintaining hand hygiene and social distancing. These three still remain the main pillars of our protection against any form of COVID pandemic. So you should always be avoiding crowded places. If you are going to crowded places, try to wear masks. Try to wash your hands frequently with soap water, and if soap water is not available, you can use sanitizer to sanitize your hands as you were doing during the pandemic, and maintaining social distancing. If anyone is symptomatic in the house, they should maintain social distancing. Our vaccinations which we have received, the boosters, if you are due, you should be taking them. In case you are having symptoms of which are suggestive of JN.1 SARS-CoV-2 infection, you should always consult your physician and try to get the tests done. And if you are having severe symptoms like excessive shortness of breath or your saturation levels are falling down, you should always try to attend the nearest emergency center. We should not be very anxious regarding the JN.1 variant, because it behaves simply as the normal SARS-CoV variant. So follow the steps which we have done through the COVID pandemic, and we will easily come out across this. Wishing you all a very happy new year and stay safe. Thank you so much.